Hi viewers! Try sitting down motionless. Do you have that uncomfortable need to move your legs? Maybe you start tapping your feet or just move them rhythmically. Well, chances are you have Restless Legs Syndrome, or RLS. Yes folks, it is a thing. It's pretty surprising that many people have it, yet most of them have no idea. You must be wondering what's causing this and how do I get it to go away? Well, stick around till the end as we uncover the 7 causes of Restless Legs Syndrome and what you can do about it. Understanding RLS. Before we break down the causes and what you can do about it, it's crucial we all are on the same page around RLS. Restless Legs Syndrome, also referred to Willis-Ekbom Disease, is a condition that causes an uncontrollable impulse to move one's legs, frequently in response to an unpleasant sensation. And it comes and goes, usually happening in the evening or at night when you're seated or lying down. Moving temporarily alleviates this unpleasant sensation. I am sure if you have it, you know exactly what I'm talking about. Chances are you are probably twitching your legs right now. So what causes RLS? Number 1. Genetics. Like many diseases and disorders, Restless Legs Syndrome can run in families. If your parents or grandparents have RLS, you may be at a higher risk. But the problem lies in the fact that diagnosing such a disorder is not common, especially in previous generations. Chances are your parents or grandparents don't even know. Number 2. Iron deficiency. Did you know that low iron levels in the brain can trigger RLS symptoms? Now this is definitely something we can work with. While you can't do anything about inheriting RLS genetically, getting it through a lack of iron means you can at least work towards minimizing its effects. We'll uncover this more in detail when we talk about how we can deal with RLS later in the video. Number 3. Pregnancy. But what if you can't help it? Well, like genetics, pregnancy is also something that might cause you to have RLS. Yes, I know, you can't be bothered with RLS when you're pregnant. The pregnancy itself is quite a ride. What's to worry about a little bump like RLS in the way? Well, it usually happens during the 3rd trimester, and you know those hormonal changes, pressure on the nerves, and increased blood volume that occur during pregnancy? Well, besides many effects, they may also cause RLS. But don't worry, we'll be talking more about the remedies to manage these effects. Stick around to the end to find out. Number 4. Chronic conditions. Chronic conditions are the worst, aren't they? To have issues such as kidney disease or diabetes must be really tiring. Besides these lifelong chronic issues, patients might also have to deal with RLS, since these chronic conditions can affect nerve function and circulation, potentially triggering RLS. It's pretty frustrating when you think about it. Number 5. Neurological disorders. An example of such a disorder can be Parkinson's, which is something quite common nowadays. While neurological disorders can take quite a toll on people, RLS adds to the misery, but you can do something about it. Addressing and controlling the underlying neurological condition can often result in a significant reduction in RLS symptoms. So, if you or a loved one suffers from both RLS and a neurological problem, obtaining comprehensive care and therapy for the latter may provide much-needed respite from the discomfort and restlessness caused by RLS. Number 6. Your lifestyle. Yes, you heard that correctly. Your lifestyle can also be the reason you have Restless Legs Syndrome. For example, smoking, excessive caffeine, and alcohol consumption can worsen RLS symptoms. Sure, while they may not be the exact reason behind your RLS, they can amplify it to a level that becomes an annoyance in your life. Maybe initially you had traces of RLS, but after these harmful substances, it has become far more common. So limiting these substances may lead to improvement. Number 7. Anxiety and stress. These conditions can contribute to Restless Legs Syndrome, and that's pretty common. High stress levels can really cause a lot of negative effects, including exacerbating the RLS symptoms. In other words, factors that negatively affect your mental health, be it smoking, drinking, or stress and anxiety, can amplify RLS. To properly understand how to counter the effects of RLS, we need to discuss how an individual can manage it. While it's always important to first consult a healthcare professional for proper evaluation and management, there are 4 common ways of managing RLS, along with reasons why they can be considered effective. Number 1, lifestyle modifications. Lifestyle changes can have a significant impact on RLS symptoms. These include regular exercise. Engaging in moderate intensity exercise like walking or swimming can improve circulation and reduce symptoms. Exercise also helps release endorphins, which may help alleviate discomfort. Keeping your body active with regular exercise also helps improve sleep quality, which can reduce RLS symptoms. Dietary adjustments. Avoiding caffeine, alcohol, and nicotine, especially in the evening, can reduce RLS symptoms. These substances can disrupt sleep patterns and exacerbate RLS. Stress reduction. Managing stress through relaxation techniques such as deep breathing, meditation, or yoga can help reduce RLS symptoms. We discussed how stress can worsen RLS symptoms, so finding ways to relax is essential. Number 2, iron supplements. We've talked about how iron deficiency can cause RLS. Well, adopting a balanced and nutritious diet that's rich in iron and magnesium can significantly improve RLS symptoms. Your doctor may also recommend iron supplements if blood tests still reveal low iron levels. Ensuring adequate iron intake can improve symptoms by optimizing dopamine production in the brain. Number 3, warm baths and massages. Taking a warm bath or receiving a gentle leg massage before bedtime can help relax muscles and ease RLS discomfort. The soothing effects of warm touch can promote better sleep quality and reduce RLS-related disruptions. Speaking of sleep quality, maintaining a consistent sleep schedule and practicing good sleep hygiene, like creating a quiet and comfortable temperature environment, can also help optimize sleep quality and contribute to better RLS management. Number 4, compression stockings. Wearing compression stockings can be helpful, especially if you're experiencing symptoms primarily at night. These stockings provide gradual pressure to the legs, which helps improve circulation and may reduce RLS discomfort. Although these methods can be effective, medication provided by a healthcare practitioner may be a realistic alternative in more severe circumstances to address RLS symptoms. Remember, the effectiveness of these approaches can vary from person to person. It's essential to work closely with a healthcare professional to determine the best approach for managing your RLS, as they can provide personalized recommendations and monitor your progress. How are you managing with RLS? Let us know in the comments below. If you found this video helpful about what causes restless leg syndrome and how to manage RLS, you'll also want to check out these other helpful videos. We'll see you there.